Jennifer Patton. I'm one of the owners of Advanced Care Veterinary Hospital, and wanted to give you an update on what we've done with our vaccine protocols in our hospital. So we've been using vaccines for years from another manufacturer and have been very happy with the results we had. But with new technologies coming out, we decided it was time to reevaluate, and we made a decision to change, and we went with the Elanco Ultra vaccine series. And there's some benefits to that you may not have noticed if you've come in, but we as practitioners have definitely seen. One is it's a smaller volume vaccine. So instead of the traditional 1 ml full vaccine size, this is a half volume size. Now it still imparts the same immunity. You're still going to get the same type of immunity for dogs that are on 3-year protocols. You'll get a 3-year protocol with it, but it makes for a more comfortable vaccine, and it helps to reduce the number of reactions that we're seeing. Part of the reason it's a smaller volume is it's an ultra purified vaccine. And so by that, they've removed a lot of the extraneous proteins and materials that they don't need, that doesn't make the vaccine effective, and we're causing some of the reactions and discomfort. By eliminating that, again, we've had a better experience with our vaccinations, particularly with small dogs and with young puppies. The vaccines are much more comfortable. Now, along with that though, there are some other changes. There are fewer products in the vaccinations. And so instead of having the traditional distemper, parvo, hepatitis, parainfluenza vaccine, there is no parainfluenza, which is actually a good thing. Injectable parainfluenza was not found to actually impart immunity against the respiratory form of the vaccination, which is very important, especially if you have a dog who goes to the groomer, goes to the dog park, goes to dog shows, dog training, anything along those lines. And so in order to get immunity for parainfluenza, which is similar to the common cold in people, so it's a respiratory virus that can cause some really bad coughing, you are going to have the Bordetella or the kennel cough vaccine in the intranasal form, meaning it has to go in the nose in order to get that immunity for the parainfluenza. But again, fewer things that we're injecting into the dog, which makes for a better vaccine experience for your pet. So now I'm going to show you the difference in the volume of the vaccines as I pull these up. Now, one thing I do want to point out is our rabies vaccine is still the traditional 1 ml vaccine. They don't make a half ml vaccine at this point, and we wanted to make sure, because rabies vaccines can cause some significant reactions, that we stayed with one that we felt was the safest. So we stayed with our traditional Novavax vaccine. So you'll get to see the difference then in the volume when we're pulling up the different vaccines here. So this is a 1 ml rabies vaccination. And we always change out the needles because that again helps with patient comfort. So that is your traditional 1 ml. If we pull up our new half ml volume, now the dog that we're going to vaccinate today does get vaccinated for leptospirosis. This dog is a herding dog, goes hiking a lot, spends a lot of time out in the woods, and so we want to make sure that we are protecting him against lepto because of his exposures. And then our Bordetella is going to be the intranasal. So this is the one that is going to go in his nose. And we do that so that we can provide for the parainfluenza, the respiratory infection. So again, if your dog's going to grooming facilities, training classes, dog parks, boarding, you want to make sure that you are getting the kennel cough or the Bordetella vaccine. So these are the 3 vaccines that we'll be administering to our patient today. So we happen to have a dog, my own dog, Lloyd, who is in need of his vaccine boosters today. Lloyd is getting his first adult vaccine booster, so he had his series of puppies finished up a year ago, and so he is now just shy of about 16 months old, so he's due for his first adult booster, so conveniently we're going to vaccinate him today. Now we're going to put him up on the table to make it easier for you to see, plus he is table trained, up. And then when we do vaccines, we do try to make this as pleasant an experience as we can. Lloyd loves some peanut butter here. Okay. So what we're going to do is keep him busy with peanut butter while we vaccinate him. So we're going to give the first vaccine. I'm going to move him so you can see a little bit better. There you go, Bubs. This is our half ml volume distemper, parvo, and lepto vaccine right up on that shoulder. And as you notice, he took that very well. What was that? Yes, get your peanut butter. A little more peanut butter here. Then we have our rabies vaccines, and we do split up our vaccines. We do one on the shoulder, one on the hip, so that if they have a reaction, we happen to know which one they may be reacting to. And as you see, he took that very well. And then our intranasal vaccine, the one that goes up the nose. I'm going to sneak this in. This one is a little uncomfortable. If you've ever had the flu mist vaccine yourself, it's okay. Here, have some peanut butter. There you go. Gotcha, Bubs. There, huh? Good job. So now Lloyd's had all of his vaccine boosters that he's going to need for the next year. His distemper parvo in this case will be a 3-year vaccine, so he's not going to need that again until 2021. His rabies vaccine this year, unfortunately, is going to be a 1-year vaccine, so he'll get that booster again next year, and he'll get his Bordetella vaccine booster next year also. Thank you for joining us today. I hope you learned a little bit of information about vaccines and why we chose to use the vaccines we do.